Hi, it's Tim from Chiro Up, and I want to show you 4 simple neurodynamic tests and treatments to help get better outcomes for your lower extremity patients. Emily's here to help me today. She's going to help demonstrate that nerves need to glide and stretch. They're much like bungee cords as opposed to static structures. And any inflammation along the way, starting at the nerve root all the way down, causes inflammation, which can create adhesions or at least limit that nerve's ability to glide and stretch, predisposing them to the 2 things they don't like. Nerves don't like compression, and nerves don't like stretch. So for us to figure out if a nerve is irritated, we're going to tension it. We're going to tension it on both ends. And so we'll talk about 4 primary nerves in the lower extremity. The sciatic nerve, its divisions, the tibial nerve, as well as the peroneal nerve. And then we'll also talk about the femoral nerve. So let's get to it. The way that we're going to tension any of the nerves from the upper end is by cervical flexion. We know that the spinal cord is under tension when the patient puts their head into flexion. And so that's the simple process for all 4 of those tests. The other part is what we're going to do to the lower end of that nerve. So for the sciatic nerve, we do a straight leg raise and a Bragard's test while the patient puts their head into flexion. And with this, we're tensioning the upper and the lower aspect of that nerve. If there's reproduction of pain or paresthesia, numbness or tingling, or the patient's chief complaint, we're very suspicious that the sciatic nerve is involved. Now the good news, the peroneal and the tibial nerves are tensioned in a very similar fashion because they're extensions of that sciatic nerve. So to tension the peroneal nerve on the outside of the calf, we're going to employ some inversion along with the dorsiflexion and a straight leg raise. In order to tension the tibial nerve, which runs behind the medial malleolus, we're going to perform that same straight leg raise. We're going to perform dorsiflexion, but this time a little bit of eversion while the patient's head is in flexion. So that's going to tell us which of those nerves is irritable. Now, 90% of problems that start at the spine that are related to discs or degeneration happen at L4-5 or L5-S1. So it's going to involve the sciatic nerve or one of their distal branches. That means 10% don't. They start above that, and that would involve the femoral nerve. So to stretch the femoral nerve, if you lie on your side, we're going to remember the top gets stretched the same way. Anytime we want to stretch the top of the spinal cord, we're going to put the patient's head in flexion, and now we're going to take their thigh back into extension with a little bit of knee flexion as well, tensioning the lower part of the femoral nerve and the upper part of the cord. If the patient has a reproduction of symptoms there, now we're suspicious of the femoral nerve. Now the good news, in order for us to treat these problems, you can flip back on your back, we're going to employ a very similar process, that when we do a nerve tension test, we're tensioning both the top and the bottom to get maximum stretch. But in order to do a nerve floss, the treatment, we're going to stretch one end while we relax the other. Think of it this way, if we had a hose that had a rope inside of it, this will be the only time I talk about a garden hose. But if we had a hose with the rope inside of it and we poured some weak Elmer's glue into it, the best way for us to release that rope inside would be to pull one end while we put slack on the other, and then pull one end while we put slack on the other, flossing that back and forth. That's the principle of nerve flossing in the lower extremity as well. So the way this works is instead of tensioning the top while I perform this lower stretch, Emily's going to move her head into extension this time while I move her ankle into dorsiflexion and her leg into a straight leg raise. So we're loosening the top while I'm stretching the bottom. Now we take it just the opposite way. She brings her head into flexion as I take her leg back down, and we come back up into extension and a little bit of knee flexion as we drop her leg down, and we're getting a stretch. The way that I teach patients to do this at home is think of somebody kicked you in the head and threw your head back. Now you look down to see who kicked you. Somebody kicked you in the head to see what happened, and then come back down. So that's how we floss the sciatic nerve. The good news is, in the same way that tensioning was very similar with the peroneal and the tibial nerves, so is flossing. So we do the same thing. We're going to put some slack on the upper end by going into extension while I dorsiflex and create some inversion. And there I'm stretching the peroneal nerve while we relax the top. Bring it back down again, and now come back up and stretch into a little bit of inversion again. Now with regard to the tibial nerve on the inside, remember we're going to perform a little bit of eversion to stretch that nerve while she goes into extension, and then flex her knee down and come back up again. So now we're getting a really good floss of the posterior tibial nerve in this case. And finally, the femoral nerve, Emily's going to roll onto her side once again. I'll stabilize with my hip, and this time we're going to do a scorpion basically. We're going to come back and her head's going to come back. As her thigh comes back, she kicks herself in the head and then comes forward and back again. So now we're flossing the femoral nerve. I hope that this information helps you with your clinical presentations, your clinical outcomes. If you'd like to see any of the videos of any of the other nerve flosses or tensions throughout the body, check out Chiro Up. Thanks for watching.